Hi, if you have high blood pressure, you don't want to miss this video because I'm going to go over some simple things you can do at home to help you have a healthy blood pressure. So my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and I've had the privilege of helping over 100,000 people over the last 34 years. And like I said, today we're going to go over simple things you can do at home to help maintain a healthy blood pressure. So what is high blood pressure? It's having a reading of over 130 over 80. That's stage one. Stage two is 140 over 90. Those were recently updated. They lowered it to 130 over 80. So now more people are actually categorized as having high blood pressure. And it is one of the more common things patients come in with in our office. And well, one of the reasons is almost half of Americans have hypertension. And actually, 54% of African Americans have hypertension. So it's disproportionately larger in the African American community. And we're going to go over why I think that is, and we're going to go over some underlying root causes and then some solutions on how to maintain a healthy blood pressure. So the patients that I see that come in with high blood pressure, one of the things they do have in common is most all of them are on high blood pressure medication. Even though I take their blood pressure, it's high, they're on medication. The reason is oftentimes medications aren't effective, and then you need to go on a second medication and then a third. I had one patient whose husband was on 5 different prescriptions for high blood pressure, and it still was high. And he was a cardiologist, and they couldn't figure that out. Well, one of the reasons is if you're not addressing the underlying root cause, then and just trying to address it, push it down with medication, the body adapts and comes back up again because you're not fixing what's going on. So some underlying root causes we're going to go over. Well, first of all, deficiencies. And in particular, vitamin D is huge in this category. And as far as getting back to why I think African Americans have a disproportionately higher amount of blood pressure is because the darker your skin, the less you absorb vitamin D from the sun. I had a patient from the Bahamas years ago who was a gardener, landscaper, did lawn maintenance, and he was out in the sun every day, all day long. He's very dark skinned, he was Bahamian, and he came in with a whole lot of symptoms, including high blood pressure and aches and pains and fatigue. His vitamin D was one of the lowest I had ever seen, and he's out in the sun all day long. And the reason is the darker your skin, the less you break down and absorb vitamin D into your system. So it's one of the most common deficiencies I see over and over again, people with hypertension. Toxins are another underlying root cause. When someone comes in, we do lab testing. Oftentimes, I'll see high levels of mercury or iron overload, another common toxin. Infections are really common root cause for high blood pressure. Like there's a particular virus that it's called cytomegalovirus that can cause high blood pressure, as do other gut infections are related to this, hormonal imbalance as well, and food reactions. So in particular, gluten is a big one. So I had a patient, 68-year-old woman who came in not only with neck and back pain, fatigue, brain fog, dizziness, insomnia, sinus congestion, digestive issues, which most of our patients that come in have, and high blood pressure. So after doing testing, one of her root causes was gluten sensitivity. So after putting her on the free diet, which I'm going to go over with you in a second, and our natural medicine formulas, which we tested to see which she was deficient in. She ended up 30 days later, her levels dropped 66 points to normal, as did her blood sugar. It came down to normal, triglycerides, inflammatory markers, and she lost 12 pounds. The diet I'm referring to is, I call it the free diet, because it's free of not only gluten, but gluten, grains, sugar, yeast, all those common allergenic foods that result in inflammation, digestive, and other chronic health issues. And inflammation is a driving force for high blood pressure. So by following this diet, it can really help in that area. As far as the supplements that I typically in general recommend are what I call the functional 5. So even if you're not getting tested and you want to do this on your own, what I would suggest is following the free diet, which I'll put a link to phase 1 of the free diet below so that you can access that food chart. And then as far as the supplements, the functional 5 you can start with. So a good quality multivitamin or active multi is what we use, along with fish oil. So omega sorb 3X is the particular one we use. So good quality fish oil supplement. Vitamin D is so important. So testing will reveal what your levels are and how much you need to take. I found that on average, most people need 5,000 IUs of vitamin D, along with vitamin K, vitamin K2. So it's really important to get vitamin K2 with that to help with absorption, and it has other benefits as well. And then magnesium malate, I think, is the best form, or you can use magnesium citrate if you happen to have constipation and need help in that area. So, but magnesium malate I like to use, and typically I recommend approximately 400 milligrams a day. It's like 400 to 600 in that area. So that's twice a day of the particular product we use. And then Probio Supreme, that's a probiotic formula. So a good quality probiotic is part of that as well. And as far as other things that would really depend on if you got testing and say you had other markers, like commonly I see B12 deficiency, folate. So those are other common things. If your inflammatory markers are high, curcumin is a great thing to add for that as well. Another patient I saw who was 54, and he had a blood pressure of 182 over 108, and he followed all the guidelines that they recommend to avoid hypertension, which was like no smoking. He didn't drink alcohol. He only drank occasionally. He wasn't overweight. Exercised regularly. Had a pretty healthy diet. Watched his salt intake, but still he had high blood pressure. His doctor said it was hereditary and needed to be on medication for the rest of his life. But he didn't accept that, so he came in, and after doing testing, put him on the free diet. All of these supplements here. I did follow up at 4 weeks, and his blood pressure came down 71 points in 4 weeks. As far as the gluten, that is a real prime driver, and a lot of people don't realize as they have hypertension, there are actually these food reactions, in particular gluten, that can really result in this inflammation and raise blood pressure. So it is really important, besides just taking supplements, to get on a good quality anti-inflammatory diet, such as the free diet, to really help. And that's what I find is the most important thing, is getting your diet under control with that. So I'll leave a link below to, if you want a copy of the free diet phase 1, and if you have any comments, questions, leave those below. Feel free to subscribe to my channel if you'd like early notification of new videos. And thanks for joining me today, and we'll see you next time.